Hello, I'm Dr. Ashish Raval, and welcome to the Total Joints for Total Care program. As a board-certified orthopedic surgeon with over 20 years of clinical experience, we've assembled a wonderful team and created a great program for your joint replacement journey through the Ortho Team Clinic and Stoughton Health. Our team has numerous experts in their respective fields that will help guide you through this joint replacement journey. The cornerstone of our program is education, and we hope that you find all the answers to your questions as you meet with various members of our team. We appreciate the trust you put in us and hope you enjoy the journey.
Hello, I'm Renee Burke. I'm a physician assistant here at Stoughton Health Ortho Team. And either myself or my fellow PA partner, Stephanie Lake Melton, will be assisting with your upcoming surgery. On behalf of everyone at Stoughton Hospital, I would like to welcome you to the virtual Total Care for Total Joints class. I'm excited that you will be able to take advantage of this valuable information from the safety of your own home. This platform allows you to watch the video multiple times and also share it with your family members that will be helping to care for you during your total joint surgery recovery period. You will be instructed by many of the people that will be caring for you during your hospitalization. If after viewing the class you still have questions or concerns, Stephanie or myself will be happy to discuss them during a preoperative discussion telemedicine visit.
Hello and welcome to the Total Care for Total Joint video. My name is Emily Gross. I'm a physical therapist here at Stoughton Health. I work both on the medical surgical unit as an inpatient physical therapist, but I also see patients in one of our outpatient clinics. And so I'd like to welcome you to this video. Under normal circumstances, we'd be meeting face-to-face, but in this environment of the pandemic, we've recorded this video for you to help you prepare for your upcoming joint replacement. You should have received a booklet, and I'd like you to be following along in your booklet at home as we go through this presentation. I've prepared a PowerPoint that we'll review, and along the way, I'd like to introduce you to a number of your care team members. Some you will have met, Dr. Raval and Renee, and others will be new to you, but they will be taking care of you in the hospital and even beyond. So let's go ahead and begin. This is your care team. Dr. Raval, Renee, and Stephanie will go on and start to review our objectives for this presentation. So firstly, we'd like to identify the different sections of your Total Care for Total Joint booklet. We're going to discuss keys to a successful recovery. We want you to acquire realistic expectations for your new joint and be able to locate resources for any questions that you may have now and going forward and beyond. Section 1, this is preparing for your joint replacement. Here we're going to find 4 components: finding a coach, preparing your home, completing pre-surgery activities, and final preparations. The first section here is really quite essential. We want you to find a coach. And what is a coach? The role of a coach is to provide practical, physical, and emotional support throughout the joint replacement process. You need a coach to support you prior to surgery, to help you prepare your home, prepare meals in advance, attend your appointments beforehand if needed, to help you gain the confidence that this surgery is going to be successful for you. You're going to need a coach to provide support during the hospital stay. Unfortunately, in this environment of the pandemic, you may not be able to have your coach with you in the hospital, but certainly by phone, by video, you can be in touch. And when this pandemic is over, you can have your coach with you again. And then we want your coach to be supporting you at home. After surgery, this is when especially you need that support person to assist you with exercises and assist you with getting food and help you get to appointments, those kinds of things. The role of a coach really cannot be understated, and we strongly discourage going into a surgery without a coach. We really think that the role of a coach is essential to the success of a joint replacement surgery. So going forward, let's talk a little bit more about preparing your home. And I would like to say in the booklet, there's a lot of information. In this presentation, we don't want to drown you with information, but we would really encourage you to closely read the booklet. All of the things that we've put in that booklet are there to help you and guide you and are more thorough than what I will discuss today. So here as we go along, I'm going to highlight important aspects that are found in the booklet, but we really encourage you to closely read it as well. So preparing your home. So there's a checklist in your booklet. We'd like you to use this checklist and inspect each area of your home to ensure that it's ready for safe use and habitation after surgery. So there are several areas that you want to do a walkthrough with. You want to look at all common spaces and look for those scatter rugs and area rugs that could be trip hazards, especially when you're using a walker. You're going to go to the bathroom and again, look for those scatter rugs. In the kitchen, you want to think about placing all items that you typically use on a surface that's easy for you to reach. So you don't want to have to reach high into cabinets or really deep into lower cabinets. And finally, miscellaneous. This covers that meal prep and kind of thinking about beyond the physical environment, what are the things that you need to have in place? Perhaps you need to have someone get your mail for you or pick up your newspaper outside. I want you to make sure to go through and review in the booklet all those items and prepare your home as best as you can for your surgery. So moving on to completing pre-surgery activities. There are a variety of activities that should be completed prior to surgery. We want you to use the following timeline as your guide, and this is highlighted in your book. To highlight a few points that we like to have you take note of. So in greater than 30 days before your surgery, a month or more before your surgery, we want you to complete any dental work that you need to have done. This is your time frame that we recommend, if not earlier, identifying that coach or support person that's going to help you throughout this journey. If you live alone, it's good to identify a coach or someone that can stay with you for the first couple of nights after surgery. This is highly recommended because those first couple of days are a little bit rough, and it's really helpful to have someone in your home who can assist you and help you physically and emotionally get through those first couple of nights at home. As we move forward in the timeline to 15 to 30 days prior to surgery, this is where you're going to attend your preoperative physical exam appointments with your primary care provider and with one of the ortho team PAs. You're going to continue working on exercises and staying active. The more active you can be leading up to surgery, the better your outcome will be after surgery. And finally, when you get down to 2 to 10 days before surgery, this is where you're getting really close and you want to make sure to protect that surgical leg. You don't want to introduce any kind of infection. So we usually have people stop shaving their legs 5 days before surgery to prevent the risk of cutting your leg. Another point to bring out is that we only want you to use Tylenol for pain management. And if you need to be using something else, you need to discuss that with the ortho team. So in addition to these items noted here in your booklet on the slide here, in the days leading up to your surgery, you'll receive a phone call from one of our pharmacists. So now I'd like to introduce you to one of them who will walk you through what you can expect related to your pharmacy care leading up to and during your hospital stay.
Hi, my name is Kathy. I'm one of the pharmacists here at Stoughton Health, and as part of your upcoming surgery, one thing that you can expect is a pre-op phone call from one of the pharmacists here at the hospital. They will want to know what medications that you're currently taking. That will include both prescription and over-the-counter medications. They will verify the name of the medication, the current dosage, and the current directions or how you are currently taking the medication. If any of the medications on your list we do not stock here at the hospital, they will ask you to bring that medication in with you for your surgery. Otherwise, just plan on the hospital providing all of the medications that you will need during your stay. At any time during your hospital stay, if you would like to speak with one of the pharmacists, just reach out to your nurse and they can let the pharmacy department know, and one of the pharmacists will come down to speak with you. You will also have a chance to meet with a pharmacist on discharge. They will come in to go over your discharge medication list. They will go over any new medications that are being prescribed on discharge. They will go over what the medication is for and what side effects you may experience. At this time, please feel free to ask any questions that you may have about any medications that you're currently taking or any of the new medications that you are being prescribed on discharge.
So the rest of the items I'll have you review on your own at home in the booklet. So we're going to keep marching forward here into final preparation. So here we are, the night before surgery. There's no eating or drinking after midnight. We want you to drink Clear Fast bottle number 1. You'll also see in the booklet a 16-ounce bottle of Gatorade is acceptable as well, and that should be reviewed with you by the ortho team. And you want to make sure to remove any nail polish, rings, or jewelry. The morning of surgery, 90 minutes prior to your arrival at the hospital, you want to go ahead and drink that second bottle of Gatorade or the second bottle of Clear Fast. You want to take any necessary medications with only a small sip of water, and you want to take a bath or shower with that Hibiclin soap. And finally, we have a recommended packing list, which is in your book as well. I definitely recommend bringing your Total Care for Total Joint booklet. It's got exercises in it that we like to use with you in the hospital. It's a great reference tool for you while you're in the hospital. If you have a question, oftentimes the answer may be in the booklet. Bring loose-fitting clothes, shorts, skirts. If you wear pants, make sure they're nice and loose. And if you have a knee replacement, that the pants can easily pull up over a swollen knee. You want to wear shoes with a back, no Crocs, no flip-flops, no slippers. Good form-fitting shoes, such as tennis shoes, are what we recommend. So in terms of equipment, we'd like you to bring a two-wheeled walker to the hospital. This is the device that you're going to want to use after surgery, whether you have a knee replacement or you have a hip replacement. There are some cases where individuals who've had the other joint operated on or have had extensive knee surgery and they've used crutches or forearm crutches in the past and prefer to use crutches over a walker, those individuals may bring their crutches to the hospital, but most individuals, most people need a front-wheeled walker. I do have the question all the time. People ask me, can I bring my Cadillac walker with a seat and handbrakes and four wheels? And we say, no, please do not, because that walker will not give you sufficient stability when your mobility is impaired after surgery. This is one piece of equipment that we would like you to obtain before surgery. It's a front-wheeled walker. It's an aluminum frame with two little wheels in the front. Towards the end of the presentation, I have a picture and I will highlight that for you. You want to make sure to bring in any items that are essential for your well-being, such as a CPAP, breathing device, hearing aids, eyeglasses, dentures. Please bring those items with you. And any important paperwork, advance directives, living will, insurance cards, your ID, and any personal hygiene items that you might require. We do, of course, have shampoo and soap and toothbrushes and toothpaste, etc. here in the hospital. But if there are things that you prefer, then please bring them. So moving on, now we're going to be covering your hospital stay, your actual visit to the hospital. On the day of surgery, you're going to arrive to Stoughton Hospital, and you're going to probably at this point in time be parking your car yourself or have your coach drop you off at the front door. If valet is in service, then by all means use our valet. And your first step is going to be going to registration. Registration, they will get you registered, take your insurance information and get you set up and ready for surgery, and then they will direct you upstairs to our surgical unit. And at this point in the presentation, we'd like to take you on a virtual tour of the hospital.
Hi, I'm Ashley. I'm a physical therapist. Welcome to Stoughton Health. You're at the hospital, and I would like to take you on a tour to show you different places that you'll experience during your stay here and during your whole surgical experience. So come on, let's go. Here is your first stop at registration. So you'll come in through the doors when you enter the hospital, and then you'll see an office with a light on and a registration person there. They'll get you checked in for surgery and let everyone know you're here. And then we'll head up to the next step. After you register, you're gonna take the green grass elevator up to the second floor. I'll see you up there. Welcome to your next stop. This is the surgery waiting area. So you'll come up here after you're done registering and just wait. And then the surgical team will come out and get you when they're ready. While you're in surgery, your family members can stay here as well, just to wait for you to come out. There will be a television screen where they will see a number on the screen that tells them where you are during your surgery process. So we'll head up to the next step. Welcome to the third floor. This is where you'll be spending the majority of your time while you're here. Each side of the floor has a nurse's station, so nurses and CNAs are readily available. We have very friendly staff that are here to help. Let me take you to a patient room. We have large rooms here at Stoughton Hospital, and they all have a private bathroom. You also have a lovely view that you'll see of the Yahara River while you're up here as well. Family members will be shown up to this room while you're recovering from surgery, so the surgical team will help with that. Thank you so much for choosing Stoughton Hospital for your surgery, and we look forward to seeing you.
Let's talk a little bit about surgery prep and during surgery. In the preoperative area, you're going to be reviewing paperwork, medications, and signing consent forms. Your surgical nurses will put an IV in place and assist you into operative attire. You're going to meet with your surgeon, and you'll meet with your anesthesia provider and discuss anesthesia options. So during surgery, under normal circumstances, your coach or family will be able to stay with you until you're taken back for surgery. With the pandemic in place, we may have visitor limitations that would prevent your family from being with you, but that changes and will have to be assessed at the time of your surgery. You can plan that your surgery length will typically be between 1.5 to 2.5 hours. And really at this point, I'd like to introduce you to one of our anesthesia providers who will give you a little bit more information about what you can expect preparing and going into surgery.
Hi, my name's Charlie. I'm one of the nurse anesthetists here at Stoughton Hospital. I will be in the operating room with you, providing your anesthesia for your total hip or your total knee procedure that you'll be having today. You will meet one of our nurse anesthetists upon your arrival in the same-day surgery center prior to you going back for surgery. We will come in at that time and explain to you exactly what anesthetic technique we are going to use. We will explain to you the risks involved, alternate techniques if there aren't any available, and then we can go over the final anesthesia plan, at which point then we will have you sign a consent form giving us permission to do your anesthesia. The two main types of anesthesia that we provide for total hip and total knee replacement are spinal anesthesia with sedation, and the second being general anesthesia. Spinal anesthesia with sedation is where we give you an injection of local anesthetic into the back, which numbs you from around your rib cage on down, and we give you sedation on top of that with a drug called propofol that goes through your IV. This allows you to take a nap basically during the procedure. The other way is general anesthesia, which is where we put you off to sleep. We take over your breathing for you by maintaining your airway with an airway device. We just hook you up to the anesthesia machine, which provides you anesthetic gas, and that's what keeps you asleep. Preferred method we do is spinal anesthesia. We think the patients tolerate this better with a lot less side effects post-operatively. Your nurse anesthetist will be with you throughout your procedure in the operating room, and they will make sure that you get safely escorted over to the recovery room afterwards, where you will be hooked up to some monitors and will be monitored by a recovery room nurse for a period of 1 to 2 hours. While you're in the recovery room, that's where we will administer any pain management blocks that we decide to do. If you have any questions about the anesthesia plan, you can discuss it with us preoperatively or afterwards when you're upstairs on the floor in recovery. If you need some questions answered, feel free to ask one of the nurses to get a hold of us, and we will be glad to come down and discuss your anesthesia course with you. We look forward to providing you a safe anesthetic during your stay here at Stoughton Hospital.
All right, so after surgery, you'll be brought into the recovery room. In the recovery room, you'll be there for about 1 to 2 hours, and really there are several things you can expect. The main thing is that when you come out of surgery, there will probably be things attached to you that were not attached to you when you went into surgery. Of course, you'll have the IV, and that was placed beforehand, but you're going to have something on your legs called sequential compression devices. They're pumping your lower legs. You may have oxygen. You'll have your knee or your hip will be bandaged up. You may have ice on. So a variety of things will be attached to you that probably weren't attached to you when you started surgery. So don't be alarmed. After the recovery room, you're going to arrive on the medical surgical floor. It's the 3rd floor of our hospital, where you're going to meet your med-surg nurse and nurse assistant, the CNA. You'll also meet your physical therapist that same day of surgery. We typically will see people for their first appointment for therapy that day that you have surgery. Additional services that you can expect are environmental services for all your housekeeping needs and our kitchen on call or food and nutrition services for all your food needs. But now I'd really like to take a moment and introduce you to one of our medical surgical nurses who can further discuss what you can expect after your surgery is complete.
Hi, my name is Jessica, and I'm a nurse with Stoughton Health, and I work on the medical surgical department. After surgery and recovery, you'll come up from the second floor to the third floor to the med-surg department, where you'll be met by members of your care team, which includes both a registered nurse and a certified nursing assistant. So after surgery, you're going to have several things connected to you. You're going to have an IV with IV fluids. You're going to have an ice wrap around your knee, and you're going to have some wraps around your legs that are going to pump up and let go, and those are to help prevent blood clots from forming. All of these will be managed by members of your care team. During your recovery, pain management is very important. We're going to help manage your pain by using ice to your knee and leg, and also through pain medications. Both of these will be managed by members of your care team. Keeping good communication with your nurse and nursing assistant will be important about how much pain you're in, so that we can help to manage your pain the best we can. During your recovery, you may have questions or concerns that arise. You can always ask any member of your care team any question that you have. If they don't have the answer, they can find somebody who does. We want your stay at Stoughton Health to be the best it can be. We want your recovery to be as positive as it can be. We're looking forward to having you stay with us here at Stoughton Health.
Alrighty, so let's go ahead and discuss a little bit of what you can expect on those 1 to 2 days after surgery. You're going to be seeing a lot of faces, you'll be meeting a lot of people, and we try not to overwhelm you, but there's a lot that has to get done in those first couple of days that you're in the hospital. This is the group of people that you can really expect to be seeing. You'll have physical therapy, and you can expect 2 physical therapy sessions on that day after surgery. You can expect to see occupational therapy. They will see you once that day. You'll see one of the ortho team physician assistants. They usually round pretty early in the morning, so they'll come by your room and see how things are going. You'll see a social worker who will assist with discharge planning, including any equipment needs that you may have or community resources that you need. You'll meet with the pharmacist to review medications and the plan and schedule for your medications prior to discharge. Of course, you meet with someone from the kitchen. They'll stop by to take your orders for your meals. And finally, you'll probably see an environmental services team member popping in to make sure that your room is comfortable and clean. So moving forward, this is kind of the big question is, when do I discharge? When do I leave the hospital? How long do I need to be in the hospital after surgery? So really what we'd like to tell people is that you should plan to be discharged on day 1 or day 2 after surgery. So this means that if your surgery is on Monday, we expect that you should discharge on Tuesday after your second physical therapy session, or on Wednesday after your first or second physical therapy session. And upon discharge, what you can expect is you'll be given written instructions from the nursing and surgical team as to how to take care of your surgical site going forward as your home. You'll receive prescriptions. You'll have a scheduled post-op visit with your physician assistant or surgeon. And then you'll have confirmation of the arrangements for physical therapy after you leave the hospital, whether that's outpatient physical therapy or home health. And typically, we really plan for most of our patients to attend outpatient physical therapy. And you want to make sure that you get that scheduled now before you get to the hospital, if you want to schedule it for Thursday or Friday of the week that you have surgery. So if your surgery is on Monday, go ahead and schedule that outpatient physical therapy initial eval for Thursday. Or if it's on Tuesday, perhaps schedule it on Friday to give yourself a little bit of time. But now, many people have questions regarding discharge and how do those discharge plans get made. So I really would like to introduce you to one of our essential team members here from social work, who will give you a little bit more information about how do we make those plans, where do people go after they discharge, and what does insurance cover.
I'm Lindsay. I'm one of the social workers on the med-surg floor. I assist with all discharge planning after your total joint surgery. So we expect that you come to your surgery with a discharge plan in mind. People do best going home and going to outpatient physical therapy at an outpatient clinic. You should be able to get that set up ahead of time with orders from Dr. Ravel's team. Sometimes people are very proactive and contact their insurance companies ahead of surgery and find out that they have not only the outpatient physical therapy benefit, but also home health benefits and skilled nursing facility benefit. What the insurance companies sometimes like to tell people is that you also need to have what's called the skilled need in order to utilize those benefits. A skilled need cannot be determined until after your surgery is performed. So once you are recovering from your surgery and working with physical therapy and the medical staff on the floor, we can determine if you would require a different form of therapy from the outpatient physical therapy that you already have set up. In that instance, a social worker would come in and assist you in changing your discharge plan from the outpatient physical therapy that you already have in place to the appropriate level of therapy that you require. We will assist in contacting your insurance companies and finding out what would be paid for as far as home health or skilled nursing facility would be.
Alrighty, so now we're moving on to the third section of the PowerPoint. This is our final primary section. It is the section of recovery. So this is where we talk about how you are going to get better after this surgery. So, first section, keys to success. There are a variety of things that you can do to aid in the success of your recovery following joint replacement. And the following highlights some of those key components, but really I've listed 6 here in the PowerPoint, and there are easily 10 or more in the booklet. And so each of them is really quite essential, and we do want you to pay attention and take note of each of these points. But here I'll just mention a few things. All right, so the first point that we're going to cover is taking it slowly. So many people look forward to this new joint, which is very appropriate. For many, this is a life-changing surgery. But still remember, this is a large surgery. It's a significant surgery, and you need to take time to rest and care for yourself in these early days after surgery. And you know, really, recovery takes up to a year, and it does take a lot of hard work. So give yourself some grace as you are going through this process. You can expect ups and downs. It's not a perfectly straight linear progress towards recovery. It's going to be ups and downs. Some days you're going to hurt more than others, and that is okay and normal and expected. There are lots of things that we will discuss that you can use to help mitigate pain or stiffness that you're struggling with. We want you to ask for help when you need it. This is why identifying that coach is so important. We do not want you pushing through and doing everything yourself. Don't go home and, the day after surgery, start doing the laundry. Ask for help. We want you to do your exercise program as prescribed. Some people are very enthusiastic and they do 3 times as much as what we recommend in their exercise program. We don't want you to do that. And neither do we want you to underestimate what you can do. We prescribe the exercises because we know that you can do them in the amount that we have measured out. And we really encourage you to follow those recommendations. We want you to eat a healthy diet. A healthy diet really helps with building new cells and healing your joints. So you need to eat a diet as recommended in the booklet. We do not want you to go long periods without moving. This is a big one. And I think probably most of you already know this, that if you sit for a long time, you get stiffer and stiffer and stiffer. So we want to make sure that you are moving regularly, not excessively. But I typically recommend get up every hour to hour and a half in those first couple of weeks after surgery. During the day, get up and move, stretch, bend a little bit. Make sure that you're not sitting for 2, 3, 4 hours at a stretch and not moving. You will really be very stiff if you do that. Anyways, you can go ahead and read the rest of those items in the booklet. All right, so moving on, we're going to talk about side effects of joint replacement surgery. So we talked about some of the keys, but now we do need to talk about some of the side effects. The first list that I want to talk about are the most common side effects. These are really universal for everyone experiencing a joint replacement. The first item is pain. And we don't want to scare anyone, but we just want you to know that you will hurt. After a joint surgery, whether it's a hip replacement or a knee replacement, you will have some amount of pain, and that is normal and to be expected. I do not expect for any of my patients that I see to ever be pain-free. But we also have ways to mitigate that pain. So we have pain medications, and you will devise a plan with your medical team while you're in the hospital for the type of pain medication that will work well for you. And we want you to stay on a schedule with that as discussed with your medical team, and that will help tremendously with managing pain after surgery. But in addition, there are other things. So icing helps. You'll receive a cryo cuff, which is a automated ice machine that you will use after surgery. That will help with pain. Actually, gentle movement helps with pain. So getting up and moving, but avoiding excessive movement and resting is also helpful. And then elevating, getting your leg up and above the level of your heart. That helps with pain. It also helps with swelling, which I'll discuss in just a moment. That's the next item, edema or swelling. So this is very common after surgery. Swelling can occur, for months after surgery. So many people are quite alarmed when their leg is, their knee or hip is quite swollen, but it is really very normal. So we want to make sure that you're elevating above the level of the heart to use gravity to help clear the swelling out of your lower legs. The next item is stiffness, and this is a common experience, especially after knee replacements, and this is why you're going to be working with your therapy team to help work on the both extension, which is the straightening of your knee, and the flexion, the bending of your knee to reduce that stiffness. And finally, blood loss. With a joint replacement surgery, there's always some amount of blood loss. Occasionally, an individual will need a blood transfusion, but it is not common, and your surgical team will discuss that more with you, but some amount is always to be expected. The following list of side effects are less common, but they may occur. The first one is muscle spasms. Some struggle with muscle spasms after surgery. We do have medications that can help with that. Gentle stretching can help. Your physical therapy team will help you find a way to manage that if that occurs with you. Post-op nausea and vomiting. Some people react to the anesthesia or the pain medications with nausea and vomiting. Again, there are things that your medical team will do to help you manage those symptoms. In more rare cases, some confusion can occur, especially with use of these narcotic pain medications. Again, the team is going to closely monitor you, and this is why we have you stay overnight in the hospital, at least one night, if not two, to monitor for management of your pain and any symptoms from medications that you're receiving. Finally, these pain medications can definitely cause constipation, so the team is going to provide you with stool softeners as you need to help with constipation symptoms. All right, moving on, this next section, I'm going to spend a little bit more time discussing. These are our red flags, and I just like to personally highlight these items because they're really important for you to be aware of, not to scare you by any means, but you need to know what to look for if there's a problem, right? So the first one is a blood clot, and this is where we're looking for deep vein thrombosis, or what we call a DVT. These are blood clots that can develop in your legs. This is why we have you doing a variety of things to prevent the development of blood clots. Ankle pump exercises. In the hospital, we use those sequential compression devices to pump your legs. And then you may also be put on a blood thinner medication, depending on what your medical team recommends. As it's highlighted in your booklet, you want to call your surgeon if you have the following symptoms. Swelling in the thigh, calf, or ankle that does not subside with elevation. A feeling of pain or tenderness in the calf or thigh, seeing redness in your leg, or feeling warmth in your leg. If you have any of these symptoms, you want to call your surgeon. And, when I talk about swelling in the thigh, calf, or ankle that does not subside with elevation, of course there's some swelling in your leg, but this is where you wake up and your leg is significantly more swollen than it was the day before. You elevate, it doesn't change. That's when you want to be calling your surgeon to discuss this. All right, the second point on this list, a pulmonary embolus, or a PE, pulmonary embolism. So this is where a blood clot that perhaps developed in your leg near the site of surgery has traveled to your lungs. This is a medical emergency. So if you're at home and you have any of the following symptoms, you need to be calling 911. You need to go to the emergency department. So the symptoms are a sudden shortness of breath. So you're breathing fine, no problem, and then all of a sudden you can't catch your breath. The sudden onset of shortness of breath. The second point is a cough with blood-tinged sputum. So you cough and you cough up something that is a little bit bloody. That's another sign that there could be something that's seriously wrong and you need to go to the emergency department. You need to call EMS, call 911, and go in. Sudden chest pain. So a sudden onset of chest pain, please do not hesitate to call 911 immediately. Anxiety or confusion. So you were totally clear-headed, no issues, and all of a sudden you feel confused, you feel very anxious. You should be calling 911. These are signs that there could be a serious medical emergency occurring, and we want you to call and go into the emergency room. Okay, finally, infection. So With infection, of course, we want to prevent infection after surgery. And the biggest key is prevention, right? So you want to wash your hands frequently. Don't be afraid to ask your family members or friends that visit, please wash your hands. Keeping your blood sugar under control can also help prevent infections. And then prior to surgery, you want to follow all the instructions for surgery preparation that were provided by your ortho team. So as far as what to look for signs of infection, you're going to be looking for redness around the wound or swelling, increased pain, increased drainage or odor from the wound, chills and or a fever with a temperature that exceeds 101 degrees Fahrenheit. If you have any of these symptoms, please call your surgeon's office to discuss. Don't wait, just call. And really, if you have any kind of concern, you should be calling your surgeon's office. Even if you feel like, well, I'm just not sure if this is anything, listen to your body and reach out for support if you need it. All right, and finally, I do have one additional section here that I would like to discuss, and this is for those having a knee replacement. So if you are having a hip replacement, you can tune out for a minute here, but we would just like to discuss what to expect beyond a total knee surgery. Going forward, in these next weeks to months and even years, what can you plan to experience from your new joint? So firstly, incisional numbness. Everyone will have a numb patch of skin on the outer part of the knee after surgery. This is very typical. The small skin nerves that are cut during the procedure, these nerves are slow to regenerate, and the area should get smaller in size for the first year after surgery, but some people continue to have a small numb area in the skin indefinitely. Swelling is very normal. As I mentioned, you can really swell for the first 3 to 6 months. Stiffness, even after full range of motion is regained, some still report stiffness. Clicking, some people have clicking in their joint after surgery. I have had many patients mention that to me, and generally it eases with time, but mechanical components can click at times. And kneeling, there's no restrictions, but about 50% may still feel discomfort with kneeling, but there are no formal restrictions against kneeling. All right, so now we've covered all the 3 main sections of your booklet. And I'm going to take a little bit of time here to cover your appendices. There are several of them. We are not going to go into kind of thick detail with any of them, but I'll just highlight a couple of points about them, but they're there for your reference. So diving in, the first one, Appendix 1, is the exercise appendix. And this one is going to get a lot of use from you, as you can use it before surgery, and then after surgery, you'll use this quite a bit. But I just want to highlight, as I have on my presentation here, 3 exercises that are going to be your bread and butter in those first week or 2 after surgery, especially the first few days while we see you in the hospital. The first one is an ankle pump exercise. This is moving your feet up and down. This is one of those clot prevention exercises. The second one is a quad set. So this is where you are trying to straighten your knee as straight as you can make it, tightening the muscle in the top of your thigh. And the third exercise is what we call a glute set. So this is squeezing your butt muscles together. All of these exercises, we're going to have you do 10 reps, holding for about 5 seconds, and you're going to repeat them every hour that you're awake. This is our prescription for these 3 exercises after surgery. So it's good for you to be familiar with them, because when us physical therapists come to see you on that day of surgery, after you come up to the medical surgical floor, we're going to review these exercises with you. So it's great if you've been doing them beforehand, you're familiar with them, you'll have some nice muscle memory built up, and they'll be easier for you to do. All right, moving on to Appendix 2. This is our pain scale and a discussion of what we call retrograde massage or swelling massage, which you can review in the book as far as the massage goes, and we will discuss it with you when you are here in the hospital. But this pain scale, we just put it on this presentation so you get very familiar with it. You'll be having a lot of people ask you about pain and where is your pain on a scale from 0 to 10. So it's good to be familiar with it and be ready to give us some numbers after surgery. Appendix 3 is moving after joint replacement. So we have both restrictions after a total knee replacement, and there are restrictions after a total hip replacement, and they're different, and I'm going to cover them in just a moment. And then in Appendix 3, you'll also see some details about getting around your home. And so those items, we're really going to talk to you more when we see you here in the hospital after surgery. Between PT and OT, we'll be assisting you with making plans for getting in and around your home. But to talk about restrictions after knee replacement, The main thing really after a knee replacement is please do not prop your knee up with a pillow. So you can see in our pictures here, we have someone laying down and they have 2 pillows propped up under their knee. And that is a big no-no after joint replacement, because we need to work toward getting your knee into full extension, or that straightening of your knee. And we find if people rest with their knees bent like this after surgery, it may feel really good at the time, but it's going to cause you to lose the ability to straighten your knee fully. And that's something that we really want you to gain back after surgery. It's really one of the most essential things that you recover after a knee replacement. All right, so then if you are having a hip replacement, you'll be having what we call a posterior approach for the surgery, which means that you're going to have precautions, 3 ways in which you may not move after the surgery for a certain period of time. And your surgical team will let you know how long these precautions will be in place. But the first item is you may not bend forward at the waist more than 90 degrees. So you're probably not going to be bending down to tie your shoes or put your socks on or pick things up off the floor. We don't want you to cross your legs, so you don't want to cross one leg over the midline of your body. And we don't want you to turn your leg to the inside. And you don't have to memorize and be totally familiar with all of these right now, but it's just good to get comfortable with the idea that there will be ways that you shouldn't be moving after surgery for a period of time. And when you are in the hospital with us, we will thoroughly review those with you and make sure that you're comfortable with maintaining those precautions. And finally, in Appendix 4, we have community resources. So these are places where you can find equipment that you may need. We generally don't recommend that you just go out and buy every piece of adaptive equipment that you could find. And that if we identify some needs that you may have, when we see you here in the hospital, our social work team will certainly be able to assist you to locate those things and have them ready for you when you discharge from the hospital. But just to come back to walkers for one moment, because I had mentioned that we want you to be obtaining a 2-wheeled walker, here's a picture of exactly what we would like you to obtain. It's an simple aluminum foldable frame with 2 wheels in the front. This is the exact kind of walker that we would like you to have as you prepare for this surgery. Finally, in the back of Appendix 4, you'll find the Department of Transportation Disabled Parking Permit application that you can send in to obtain a parking permit to make getting in and out of clinics easier for you after surgery. So that brings us to the end of this portion of the presentation. I'm so thankful that you took the time to watch all of this. We hope that you thoroughly review all the information in your booklet. Please reach out to the ortho team if you have any further questions. And we look forward to serving you here at Stoughton Health.
We hope you've enjoyed meeting the members of our team as they guided you through your upcoming joint replacement. We hope we've answered all of your questions. However, if more questions do arise, please don't hesitate to contact us at the Ortho Team Clinic. We're always here to answer any questions you might have. Thank you again for trusting the Ortho Team Clinic at Stoughton Health for your upcoming joint replacement.